Hello students, this is Professor Lopez and we are back with another pharmacology video. Today we are going over angiotensin receptor blockers, also known as ARBs. As with all medication classifications, we are going to go over the 5 pivotal components of a medication classification. That being, does this medication have a specific suffix and how can we identify this medication on an exam? Number 2, what is the mechanism of action? How is this medication achieving its therapeutic response? Number 3, what specific disease processes are treated with this medication? Number 4, are there any side effects that specifically apply to this medication? And 5, which specific nursing implications does this medication have? And as a nurse, what should you do prior to administering this medication? Now with angiotensin receptor blockers, before we learn about these specific properties, we need to be able to identify this medication on a nursing school exam or our NCLEX. Angiotensin receptor blockers all share the same suffix, which are sartan, S-A-R-T-A-N. Regardless if an exam gives you losartan, valsartan, candesartan, these are all angiotensin receptor blockers. So by being able to identify this specific suffix, we can identify which medication classification this drug belongs to, which is half of the battle in pharmacology. Now that we can identify what is an angiotensin blocker in comparison to other drugs such as beta blockers, ACE inhibitors, or calcium channel blockers, how does this medication achieve its therapeutic response? Angiotensin receptor blockers specifically block the receptors that are on the receiving end of angiotensin II. Unlike other medications, ARBs allow the conversion of angiotensin 1 to 2, but they block the receptors that receive, thus preventing vasoconstriction and promoting vasodilation. Another very specific property is that this medication stops the release of aldosterone. Aldosterone, as we know, is a specific hormone that promotes sodium retention and promotes potassium expulsion. So by preventing aldosterone secretion, we are not promoting absorption of sodium and we are not promoting excretion of potassium. Now that we understand what this medication does and how to identify it on an exam, who takes this specific medication classification? Angiotensin receptor blockers are more often used to treat hypertension. It is an anti-hypertensive medication. And I would like to emphasize this is not a first-line treatment for hypertension. This as well is utilized as an adjunctive medication for heart failure. So you're going to see this medication utilized in patients that suffer from heart failure. And what I would say is the paramount utilization for this medication in regards to your examinations is that this medication is the medication of choice for patients that exhibit a dry, non-productive cough while taking an ACE inhibitor. So if you have a patient that exhibits that specific symptom, your medical provider will more than likely switch them from an ACE inhibitor to an angiotensin receptor blocker. So to a medication that ends in that suffix sartan. Side effects. Whenever we're talking about a specific medication classification, it is very important to be able to identify what are the paramount side effects associated with that medication. Number 1, being an anti-hypertensive medication, we need to assess for hypotension. Whenever a medication drops that blood pressure, we need to monitor that it is therapeutically dropping it and not to an alarming level. We need to as well assess for orthostatic hypotension. A very specific sign and symptom to ARBs is that these medications can cause hyperkalemia. That is an increase in the potassium levels in your patients, specifically over 5.0. The last side effect I would like you guys to take note of is the potential to cause upper respiratory infections and nasal congestion. This is a very specific sign and symptom to your ARBs. So to recap, hypotension, orthostatic hypotension, hyperkalemia, and nasal congestion and upper respiratory infections. To round off this presentation, we are going to talk about what specific nursing considerations you as a nursing student need to monitor in these patients. So being that this is an antihypertensive medication, you need to monitor that blood pressure. And as we know, the magic number to hold medications is any blood pressure under 90/60. If your patient has under 90/60, you are to alert your medical provider and hold the medication. We need to monitor the heart rate, and we need to monitor that potassium. As we know, hyperkalemia is a key factor in causing electrical dysrhythmias. So medications that can cause hyperkalemia, we need to monitor for cardiac-related side effects. Lastly, I want you to educate and assess these patients in their knowledge for sodium replacement products. Patients with hypertension usually use sodium replacement products. Unfortunately, these products are high in potassium, so they are not to use salt substitutes. Salt substitutes are unfortunately high in potassium. If these patients take salt substitutes which are high in potassium, they're more prone to hyperkalemia. Now that we have solidified the 5 key components, we can identify what an ARB is, what the specific mechanism of action is, what specific nursing considerations and side effects pertain to this medication. We are ready for NCLEX style questions. I will be releasing an additional video with NCLEX style questions that pertain specifically to angiotensin blockers. With that being said, class, I will catch you guys next time. And as always, feel free to leave me comments below if you would like me to focus on a specific medication classification.